Hi guys. My name is Twinkle. I am an Imperial offer holder, as Siddhant said. And basically today I'm going to be talking to you about all the information I wish I had before I applied to medicine, and everything I wish I heard when I was in your shoes. So let's get started. Ooh. Okay. So the first thing I thought I'd point out to you is deciding on medicine and seeing whether it's the right thing for you. So I think it's really important to know why you want to do medicine, because when you meet interviewers and when you apply, they want to know why you want to do medicine, so that 2 years down the line you realize that this is what you want to do and you're not someone who wants to drop out because they're not enjoying it anymore. And so before you start, it's really, really important to know where you come from, like not in a where I come from way, in a why you want to do this way. What's your motivation? What's driving you? And so here I've got some prompts about what you should ask yourself. What about the job entices you? What about the course is interesting to you? What do you look forward to? And ask yourself all these questions as you're going through this process, because it will help to keep you motivated. And so one of the first things I think everyone should know about is UCAS, because when I first started out about this, I didn't even know what UCAS was. And basically it's the platform through which you apply. So in the UK, universities don't accept you giving them a direct application. They want you to apply through UCAS, which kind of regulates and standardizes everyone's applications. And so within this, you can pick 4 universities to apply to for either medicine, dentistry, or vet med within this sort of bracket. And then most people can apply to 5 universities for their course. But for us, your 5th choice has to be something different. And this is because applying to medicine is such a gamble that a lot of people end up not getting any offers for the course that they want to do. So your 5th has to be some kind of backup, so that you have a plan B in case you don't get any offers. And a lot of people choose biomed because it's very similar to medicine, but it's kind of without the practical aspect. So it gives you a good foundation in case you want to reapply later. And so on this platform, you submit your predicted grades, your GCSEs, your teachers put in their references, and I guess the most important part is your personal statement, which is basically where you talk about yourself and you introduce yourself to unis, and you tell them why you want to do medicine, why they should pick you, why you're a worthy applicant. And so there is a UCAS deadline as to when you need to apply, and that ends up being sometime early October of year 12. And this is earlier than other UCAS deadlines for other courses, but that's because medicine is so oversubscribed that they need longer to process all the applications. And so I think when you're preparing to apply, the first thing to think about is work experience. And this is so important because every university wants you to know what you're getting into. They don't want students who are delusional and kind of have this idea of medicine that they've based off of something like Grey's Anatomy. They want you to know what it really is like being a med student and being a doctor. And so within this, what normally happens is you shadow a doctor in like clinics or on ward rounds, in operating theatre, sometimes in a GP setting. And so it's really important that you get your application in for work experience really early, because this is so oversubscribed that it's basically a first come first serve basis. And so like try every tactic you can, contact all of your connections, just see if you can get like a week of work experience in any department or any speciality, preferably one that you're interested in, but every kind of experience is going to be useful. And so I've just put in some tips about what will really help you make the most of this work experience time. And I think the best thing is to keep a notebook on you and take notes, so that every time you see something interesting or something that you want to talk about in the future, you can write it down and you can refer to it later, because it's really, really easy to forget what you see, especially if you do it sometime like summer after year 11 or year 12. By the time you're actually in interviews, it's been like a year since you've actually been on work experience. And so to make the most out of this opportunity, ask questions, be curious. Like the doctors won't mind, they're super friendly, and they try to appear more friendly as to recruit more medics in the future. And really make the most of it, because it is a really worthy opportunity. And so the next thing I wanted to talk about was volunteering, because obviously unis know that getting work experience is really difficult because so many students need it. And that's why they don't make it compulsory for you to have work experience. But one thing that they do really, really prefer is volunteering. And this is normally in like a clinical setting, excuse me. So around vulnerable people, like in a care home or with dementia patients or sometimes disabled people, because work experience is kind of like a passive thing because you're shadowing other doctors, But when you're in a volunteering kind of role, you're more active because you have to take responsibility and leadership, because you're actually put in a position where you have to do things. And so this helps you develop a different skill set. So even if you do have even if you do have work experience, it's really, really important that you also have volunteering. And for me, volunteering is something that I actually didn't end up getting because I didn't have time in the end, because I applied too late. And that's something I really, really regret, because it would be something that's really useful to talk about at interview. So I definitely recommend sorting out your volunteering early, preferably at the start of year 12, so that come personal statement time, come year 13, you've got it out of the way and you can focus on school. So to make the most of it, I'd say the same thing as work experience. At the end of every day, jot down everything that you did, kind of things that stand out to you, and aim for like a few months of consistent volunteering where you go for maybe an hour or a few hours a week for a consistent period of time, so you can show your commitment to medicine and to show that you're willing to put in the hours and the time, because you want to do this for the rest of your life. And so I think one of the most daunting questions as to when you're doing medicine and when you're applying is where to apply, because obviously there are 33 med schools in the UK, which is quite a lot. And in the beginning, they can all seem really, really similar. But picking which 4 to apply to can be made easy if you ask yourselves these questions, which I've listed in the PowerPoint. And I think the first thing that cuts a lot of things down is location. So for me, I was only willing to travel 2 hours away, and I didn't want to travel more than that because I was planning on coming home quite often. And so that basically excluded all the unis in the north, all the unis in Wales, most of the unis in the Midlands, some unis in the south. So that really helped me narrow down my options. And then the next thing you should ask yourself is the type of course you want to do. Now, obviously, if I ask you this now, you're probably going to say medicine. But within medicine, there are 3 types of courses that they have, and each of them have different teaching methods. And I've listed more about that later, so I'll come back to that. But that definitely helps you kind of identify which way you learn and what kind of course would be best for you. So I think the next thing to think about would be entry requirements. So depending on the uni's standards and on their prestige, each of them have different entry requirements. And I think it's really useful to be practical and strategic about where you're applying according to your grades and according to your strengths. And by this, I mean, is that different unis look at different parts of your application when they sort through students. So some unis place a lot of emphasis on your entrance exams, and they rank all the students and pick the top ones. So if you've got a really good entrance exam score, then obviously it'd be a really good idea to apply to those universities. Some universities really look at your GCSEs. So if you've got a really strong set of GCSEs, then apply there. Or if you've got a really strong personal statement and you've done so much to show your dedication to medicine, then go to a uni and apply to a university that really looks at your personal statement. So kind of linking into that is when you look into what entrance exam a university uses. So for medicine, there are 2 different types of entrance exam. There's the UCAT and the BMAT, and they're both very different exams. A lot of people say that the BMAT is the harder one, and that's definitely something I found. And the more competitive unis kind of look for BMAT, kind of like Oxbridge, a lot of the London universities, and some like Brighton. And so if you're not planning on applying to those universities, then really you don't have to do the BMAT. And if you don't want to do the BMAT, then you don't have to apply to those universities. And that really helped my friend who wasn't planning on doing the BMAT at all. And so that cut out like 10 universities for her because she just didn't want to do the BMAT. And so that's another thing that helps you sort of refine which med school you want to go to. And another point, which isn't as important, but definitely is a factor to think about, is prestige. So for a lot of people, it's really appealing to go to a really prestigious university. But one thing to always keep in mind is that this is medicine. So they have to have a standardized course. So everywhere you're going to learn the same thing. And it's not like other subjects where some degrees from other unis are worth more than other degrees from other universities. Here, every degree has the same value and the same worth, because ultimately you're going to go into the NHS, you're going to become a doctor. So everyone is equally as qualified. So just keep that in mind when you're considering prestige, even though it is something that draws a lot of people in towards some of the higher performing universities. And then I think, lastly, the most important thing is the feel of the university. So after you've sort of looked through all the questions that I just talked about, you'll have like a short list of about 7 to 10 universities. And I think it's a really good idea to go to the open days of those universities. And right now with the coronavirus epidemic, I don't really know what's going to happen regarding open days. But as soon as they open up again, I'd say it's a really, really good idea to go and visit those universities, and kind of get a feel for the environment, how they treat their students, talk to the students there and see how they like it. Ask them about what their favorite thing is about the course. And that will really help you see if you can imagine yourself going to that university and seeing if you like it there. Because remember, you've got to spend 6 years here, so you've got to make sure that you're really picking one that you're going to enjoy. And then there's intercalation. So intercalation is basically where you get two types of courses. One is 5 years and one is 6 years. In a 5-year course, you just do, you basically have lectures on the information about medicine, like the academia, and then you have patient contact. But then in a 6-year course, you take 1 year out to do research. And at the end of that 1 year, you get a Bachelor of Science degree in whatever topic you were researching. And so for some people, that's really, really appealing because they're interested in the academics of medicine. And so that's why I shortlisted universities that allow me to intercalate, and they allow me to take a year out and really focus on the aspects of medicine that are more scientific, and that can further help reduce the long list of universities. And then the very last thing is to think about Oxbridge. So obviously the way that they teach medicine is very different, but that can definitely be something, if you're thinking of considering, then it can have a knock-on effect on the rest of your universities, because it's such a gamble and a lot of it is based on luck, that it means that sometimes you have to be a little more strategic, because you have to make sure that you at least get enough from somewhere. So if you're thinking about Oxbridge, then just be very careful with your other options. Okay, the next thing I wanted to talk about is the types of courses. So I mentioned this before, and I said that obviously when you intercalate, there are 2 types of courses, but then there are 3 different teaching styles that universities use. And the first type is PBL, which stands for problem-based learning. And examples of these kind of universities include Manchester University and Queen Mary's University. And basically, these universities follow an independent learning and teaching style, where in small groups that you'll form at the start of your course and stay with until the end of your course, you'll be given a topic or a scenario every month or so, and you have to work through this topic using questions as prompts, and you find out all the information for yourself using books, online resources, and of course you can consult your professors, because you still have some lectures that support your research, but most of it is independent guided learning. And there are loads of pros to this, because it means that you get really early patient contact, because in order to relate all this information to your topic, you talk to patients. And for people who are really practical and hands-on and love doing things, this is really good, because it helps to keep you motivated, and it means that come revision time, you remember stuff more because you actually did it at the time and you didn't just passively take in the information from a lecture. But obviously, if you're somewhat of a perfectionist, like or you don't like having to do things on your own and you very much like being spoon-fed information, then it can be quite difficult to keep up with that independent pace. So for me personally, I'm a massive perfectionist, so finding out that I have to, you know, find out all this information for myself was very daunting, because I'm constantly gripped by the fear of missing out something. And obviously your lecturers are there to support you, but for me it was just something that I didn't prefer. So that automatically crossed out a lot of PBL universities for me. But if that's something that you really like, then obviously go for it. And on the university websites, it always tells you the percentage and the amount of PBL that they include in their course, which is really, really useful and really informative. So definitely have a look on there. So the next type of course is kind of like the other extreme. And examples of this include Oxbridge, and these are called traditional courses, where it's 3 years of preclinical, and because Oxbridge are both 6-year courses, one of those years of preclinical is an intercalated degree, where you get a Bachelor of Science at the end. And then you have 3 years of clinical, where you shadow doctors, and you learn as you do things as you go along, by taking notes for the patients, or maybe taking bloods, and you spend all 3 years on the ward. And it's very good because you get 3 years of just academia, so you're like any other science student. You kind of have the same lectures and the same tutorials as them, and so you have a really good grasp of the science behind medicine before you see your patients. And for some people, that helps them make the most out of their patient contact time, because they actually understand what's going on in the hospital. Whereas if you had patient contact from the very beginning, you're more bewildered at the start. So some people argue that it might not be as useful. However, a con of this is definitely that in those first 3 years, it can become very difficult and tedious to keep up with the heavy scientific knowledge that you're being bombarded with, especially if you were looking to interact with patients even more. then it'd be really, really difficult to kind of keep up with that pace of heavy science. But then again, it depends on how you learn. So for me, I really like learning through lectures, because I find that if I'm being given all the information, my memory is good enough to kind of keep it going. So Oxford really appealed to me. So I did apply to Cambridge because I really like the look of the course. But finally, the third type of course is integrated. And this is kind of the course that most universities in the UK do, where it's kind of like the best of both worlds between PBL and between traditional. So they have some PBL within their course, but most of it is guided by lectures. But throughout those lectures, you'll still have even an early patient contact. So maybe once a month or once a week, you'll go to the wards to shadow a doctor, but then you'll have a lecture on that later. And maybe twice in a half term, you might have a PBL course that you'll have to do with your group. And so this really appealed to me, and this was my favorite type of teaching style. So most of the universities I applied to were integrated courses. And I've given examples of them at the top. So Imperial, UCL, and King's. They're all London based, and they all also allow you to intercalate. So they were really appealing to me. But I think the only con of this is that if there's something you really don't like about either traditional or PBL, then it still has that in it. So for example, if you really hate lectures, then it might be best for you to go for a PBL course rather than an integrated course. Or if you really don't like PBL, then it might be best to go for a traditional course rather than an integrated course. But I think that's most of it on courses. The next thing I want to talk about is entrance exams. So as I mentioned before, there are two types of entrance exams. Sorry, I'm just looking at the time. Yeah, there are two types of entrance exams, the UCAT and the BMAT. And they're both very different. So the UCAT is a computerized examination, and it's 2 hours long, and you have 5 sections. And there's more information on the 5 sections in the link that I've put at the top. And I think at the end of this PowerPoint will be emailed out to you. So I'm not going to click on any of the links right now, but they're for your use later. And basically this works by you give the exam on a computer, and you can pick any date to take the exam between June and September. And after you've taken the exam, within 5 minutes, you can go to the counter and pick up your result. So as you walk out of the test center, you'll have your result with you. And for me, that was quite shocking, because obviously I'd never done anything like that before. But you kind of get more familiar with the concept as time goes on. And for this, I'd recommend taking at least a month to prepare, or maybe starting at the start of year 12 and doing a bit every week, so that by the time that June or September comes around, and then you're prepared and you're really familiar with it. And the style of the exam is such that it's like an IQ test, but the only way to improve it and to improve your score is to do more practice, because obviously there's no prior knowledge that you need. The total exam is scored out of 900, and you get 300 marks just for showing up. So a good score is anything above 600. And if you get above 700, basically any university will accept you. So that's kind of where to aim. And then in the notes of this slide, I've linked lots of resources like books, courses, and online question banks that would be really useful for anyone who's looking for, how to guide them through their UCAT preparation. So the next type of entrance exam is the BMAT, and this is very different to the UCAT. I think it's a similar time. I think this is also 2 hours, but this is written, so it's not on the computer. And there are 3 sections. There's critical thinking, which is kind of like about arguments, and you'll be given a paragraph and be like, what's the conclusion of this argument? Or pick the statement that strengthens the argument. And kind of like that. So again, that will get better using practice. And then the second section is science-based questions. And here, it's based off of GCSE maths, physics, biology, and chemistry. And I know that sounds really easy, but none of it is knowledge recall. It's all application. So they'll take a concept that you know and ask you to apply it in a way that is quite difficult to understand. And because it's so time pressured, it means that you need the most practice in the science-based questions. And then the third section is an essay. I say essay, but it's something like 3 paragraphs. You don't have to write very much. And they'll give you a choice of 3 topics. And one of them tends to be on medical ethics. And I'm sure joining the medical debate will definitely help you with that. One of them is philosophical, and one is to do with, I think, veterinary something, because I think vet med students also have to take the BMAT. And so that's not that difficult, as long as you do 1 or 2 practice essay plans before. But I think time is the biggest enemy in this. And I've linked the official website at the top of this slide as well. And that'll give you more information about the 3 sections, but also on the website is the revision guide. And basically that includes all of the assumed knowledge for this section and for the entire examination. It basically tells you everything you need to know. So learning that off by heart will give you a really, really good standing for scoring well. And also on the website is all of the past papers since something like 2008. So I think the best way to prepare is obviously to do the past papers, but once you're ready and once you've looked through the content would be best. So I'd suggest something like 3 weeks or maybe a month to prepare for this. And there are 2 exam dates on this, unlike the UCAT. One is in August and one is in October. So the August one, you'll get your results before the UCAS deadline, but obviously in the October one, you won't know your result before you apply. So that's a bit more of a gamble, but some people prefer it because you get a bit more time to prepare. And so that's really like personal choice. But obviously I think it'd be best to know your result before you apply to the BMAT uni. And the way this is marked is that section 1 and section 2 are marked out of 9, and an average score is between 5 and 5.5. So really, if you want to go for Oxbridge, like a appealing score would be something in the high 6s. And then section 3 is marked out of 5, and a good score is anything above 3. And then they have a lettering system for section 3, where it's basically to do with how good your English is. But really, in order to do badly on that part, you have to be trying really hard to make your English incorrect, which isn't something to worry about. So again, for this, resources are all linked in the notes. And so there are books, courses, question banks, and I think it's a really good place to start for preparation with the BMAT. Another aspect of your application is the personal statement, and I talked a bit about this before, but at the top I've linked on the official UCAT website, they have a video on how to start writing your personal statement, and I think that's a really good place to start and to get a good idea about what the personal statement is, what they're looking for. So definitely go have a look at that after this kind of talk. And the purpose of this is to give unis a basic idea about you. It talks about your personality, why you chose medicine, how dedicated you are, whether you're worthy, why they should pick you, that kind of thing. So this is an excellent opportunity to talk about your work experience, your volunteering, and you can reflect on what you've seen and what you've learned. That's really what they're looking for. So they don't want someone who says, oh yeah, I saw a tonsillectomy, or, you know, one part I really enjoyed was talking to the patients. No, they want you to reflect. So what you'd want to say is, I learned about how intricate surgery is and how much precision and manual dexterity surgeons require in order to perform something like a tonsillectomy. Or I realized how important communication skills are when talking to patients, and realizing that what you say to them is really important in boosting their morale and making sure that they understand what's going on, so that you can maintain that doctor-patient rapport, that kind of thing. So you really need to reflect on your experiences. It gives you an opportunity to show enthusiasm, so you can talk about any independent research or reading you've done. And in the slide, I've written lots of books that are really, really good for reading. So maybe a sentence in your personal statement can talk about what you've learned from those books. I don't know if many of you have heard of this, but there's something called an EPQ, which stands for Extended Project Qualification. And that basically gives you the opportunity to research a topic of your choice for something like a few months. And at the end, you have to produce a report that kind of sums up everything that you've learned. And that's a really, really good opportunity to show them that you're really interested in medicine and that you want to take it further. Sorry, give me a second. You have to remember to really sell yourself, you know, tell them why they should pick you. What skills do you have? What have you learned? Maybe you've played piano for 6 years. Okay, that's given you great attention to detail. That's given you the commitment to practice. Maybe you play a sport for a team. That's probably given you great team working skills and great communication skills. So it's kind of just those tiny things. One of the final steps in your application will be your interview. And these calls come around December time, and can go on for longer, up till February. And there are 3 types of interviews. So there's MMIs, panel interviews, and Oxbridge interviews. So MMIs are described as speed dating for interviews, and they basically stand for multiple mini interviews, where you have a bunch of stations, and each station there's a different interviewer asking you a different question. And that's basically to test how you cope in a new environment. And it's kind of really useful. This is my preferred style of interviewing, because at each station you have a fresh start. So any prejudice from a messed up question won't carry on to the next station. And I think that's really, really useful. And that also helps you demonstrate how good you are with people, because you're interacting with different personalities. And the questions can be about medical ethics, which again, the medical debate can help you with. They can be about anything. They can be about your work experience, they can be about your skills, they can be about you know, any kind of experience that you've had. They want you to talk about why you want to do medicine. So everything in the end will link back to medicine. And that's kind of how most universities operate. They have MMIs, but some universities have panel interviews, which is where you have 2 to 4 interviewers, and they're asking questions for about 20 minutes to half an hour. You can read that. And I think that's a little bit more daunting because you have to spend more time with these people. But I think it's all right to get through, especially if you're good with first impressions. And like with a lot of practice, interviews aren't that bad. So in the notes of this slide, I've linked lots of good resources with practice interview questions. So definitely have a look at those before your interviews. And the final type is Oxbridge. And they have completely different interviews to anything I've ever encountered. And it's very academic. So what they'll do is they'll talk to you about a topic that you've never come across before. Like my Oxbridge interview was about, what was it? It was about HIV, I think. And they basically taught me about how this virus works. And at the time we hadn't even covered viruses in my A-level course. So I was like completely thrown in the deep end. And basically they want to see how you're thinking and they want to see how you cope with the new situation. And the whole point of it is to see whether you'll be suitable for their style of teaching. And again, there are links in the notes to help you with that. Okay, I'm coming near the end and then soon there'll be time for questions, so hang in there. So this is a brief timeline of how the application works. So during year 12 and even before year 12, so for example, in the summer after year 11, that's really when you've got your opportunity to enrich your application. That's when you should do your work experience, your volunteering, your further reading, your EPQ, so that it's all done before you write your personal statement in the summer after year 12. And you can concentrate on school during year 13. So in the summer after year 12, you also have your entrance exams, so the UCAT and the BMAT. So most of that time will be spent preparing for those. And that'll basically take up the most of your time. And then in October of year 12, October of year 13, there's the UCAS deadline for medicine. And here you have to submit your personal statement. Obviously, everything has to be ready from your school side. You put in all your predicted grades. And that's really important because you need to make sure that your grades are in a place where universities can accept them. So obviously for medicine, they have quite high entry requirements. So before that point, you need to make sure that your school has enough evidence to show that you're worthy of your predicted grades. And then after you've applied, interview calls come in, as I mentioned before, from December to February. And then offers come out for Oxbridge in January, but most other universities give them out in March. And then I think you have a UCAS deadline in June to accept your like favorite university, and you put that as your firm choice. And then you have an insurance choice, which is kind of like a backup, so it'll have lower entry requirements. And then you'll do your A-levels in May or June, and then results day will come along. And if you meet your firmed university, then you go there. And if you don't meet it, then you go to your insurance. And that's basically it. Here I've linked some really useful resources that are a really good starting point for anyone who's looking for more information. I definitely recommend the Medic portal. It becomes like your Bible because it has everything you need to know on there. And then the others also really